right. You remember it. So these two micropreparates are similar. You see aorta, it is open. In this case, it is atherosclerosis, severe atherosclerosis with atheromatosis and thrombus. Only aorta. When you see aorta and lymph nodes, that is Hodgkin disease. Lymphogranulomatosis or Hodgkin disease. You see groups of enlarged lymph nodes due to tumor, Hodgkin disease. Okay, this one, that is bladder, ureter, and kidney. Here you can see prostate. Prostate is enlarged due to hypoplasia or adenoma of prostate. That's why something like obstruction of urinary tract. That's why you see hypertrophy of wall of urinary bladder. It is walk hypertrophy because of overworking. Thick wall. Walk hypertrophy, but it doesn't help, and urine is still accumulated in ureter and kidney, so kidney and ureter enlarged. It is called hydroureter nephrosis, enlargement. And when you look to cortex of kidney, it is thin and atrophic. It is called pressure atrophy because of an accumulation of urine and high pressure to cortex. Pressure atrophy. So one micropreparate and a lot of pathological processes. Adenoma, hypoplasia of prostate, walk hypertrophy of urinary bladder, hydroureter nephrosis, and pressure atrophy of kidney. Next one, it is heart, pericardium, it is opened, and you see fibrinous films on the surface of heart. It is called hairy or shaggy heart, or bread and butter pericarditis, or cor villosum, many names, but only one pathological process, fibrinous pericarditis, accumulation of fibrin in cavity of pericardium. In some areas it looks like hairs, that's why hairy heart. In some areas like bread and butter pericarditis. But first of all, it may be due to rheumatic heart disease or sometimes due to uremia, fibrinous inflammation in serous membrane. Next one, that is brain, and you can see large area of destruction of brain tissue, that is ischemic infarction of the brain, and you should know characteristic of it. It is irregular in shape and pale in color. Pale, irregular. Microscopically, that is liquefactive necrosis, because of a lot of water in tissues. That's why liquefactive necrosis. Most common cause is ischemia due to atherosclerosis of brain vessels. That one similar, but here you can see hematoma, that is internal bleeding, accumulation of blood in ventricle of the brain hematoma. This mostly due to hypertension and rupture of blood vessel. In this case, blockage. Next one is kidney. That is normal part of kidney, that is tumor. You see that normal part is small, so that was baby. Most common kids tumor, nephroblastoma or Wilms tumor. It is malignant tumor, but it is encapsulated. It is called pseudocapsule. We can't call it true capsule because it is malignant tumor. So that is exception. Malignant, but expensive growth like benign, because of pseudocapsule. In the middle you can see focus of necrosis. That's why cavity. You want another kidney. This one. Again kidney, again tumor. You should rotate to normal position. That is normal part, that is tumor. Compare normal part, it is bigger in comparison with this. So adult kidney. Most common tumor, renal cell carcinoma, or another name is clear cell carcinoma. That is microscopical characteristic because tumor cells collect fats, lipids. Fat was diluted during fixation, during staining, and we can see a clear cytoplasm, white spaces in cytoplasm. That's why a microscopical tumor is pale pink. Clear cells, clear cell carcinoma because of lipids. Tumor is malignant. It has invasive growth, but again, exception, hematogenous spreading, hematogenous metastasis. All carcinomas prefer to metastasize by lymph, you remember, but this one is exception, hematogenous spreading, because of growth of the tumor. Very often it grows to the renal vein. That's why it spreads to liver and other organs. Renal cell carcinoma, but hematogenous spreading, exception. That one I showed you last class. It is tecoma, benign tumor of ovary, theca cells, stromal tumor. You see yellowish, whitish areas because of accumulation of lipids, and some areas with hemorrhages. Tumor can produce estrogens. Then this one, it is splenic infarctions. You can see whitish areas with infarction. Again, you should know characteristic. It is wedge or triangular shape and pale in color. Pale triangular. Microscopically, that is coagulative necrosis because that is solid organ, a lot of lipids in it. Oh, sorry, proteins, a lot of proteins. That's why coagulative necrosis. Splenic infarction. I don't remember, maybe it's absent in your list, but that is intestine, mesenteric lymph nodes, and you can see metastasis there, white dots. I think it is absent. I will not show you this micropreparate next time. This one, again, uterus. It is enlarged in size because of previous pregnancy, postpartum uterus. And here you can see inflammation, endometritis, fibrinous films in the lumen and pass between muscle fibers. So fibrinous purulent, according to the localization, endomyometritis. Fibrinous purulent, endomyometritis. Then this one, it is hard, left ventricle, it is opened. You can see aortic valve and vegetations on the surface of aortic valve. That is septic endocarditis, subtype of sepsis. And you should know structure of these vegetations, fibrin, microorganism, necrotic tissue is present, and main complication of it is thromboembolic syndrome, when particles of these thrombus come to the bloodstream and spread throughout the body. That's why multiple infarctions in different organs. That is type of sepsis, septic endocarditis. Compared with this one, again heart, but here you see mitral valve, mitral stenosis. That is rheumatic heart disease, rheumatic fever, rheumatic heart disease. Again, you see vegetation on the surface, but not so big. That is aseptic inflammation, no any microorganism there. And clinically, it is heart failure because of mitral stenosis. It has name fish mouse. Too. This one, again, brain, longitudinal section to brain, brain tumor. Most common malignant tumor, glioblastoma, that is malignant tumor of astrocytes, undifferentiated, very dangerous tumor, and you can see hemorrhages here. Brown areas usually, so many questions about this microbiome. That one is goiter, thyroid gland. It is enlarged, that's why we called it goiter, and you can see multiple nodules on the cut surface, so that is nodular goiter because of nodules. In some areas, dark brown colloid, excess of colloid, nodular goiter. Now, tuberculosis. You see lungs and multiple tiny focuses around 1-2 millimeters. That is miliary tuberculosis, like millet seeds. It may be type of hematogenous tuberculosis, or it can be after hematogenous progression of primary tuberculosis. But it needs invasion of mycobacterium to the bloodstream because it is hematogenous spreading. So hematogenous or progression of primary tuberculosis, miliary tuberculosis. Of course, I can ask structure of these focuses. You should discuss caseous necrosis, epithelioid cells, lymphocytes, Langerhans, giant cells. That is miliary tuberculosis. Another type of tuberculosis, fibrous cavernous. You can see fibrous tissue lung and multiple cavities, caverns. That is secondary tuberculosis type, most common type of secondary tuberculosis, and in that area, this white spot, it was primary tuberculosis, Ghon's focus, and healing of it with calcification. That's why this area is white colored. So patient had primary tuberculosis, healing of it, then reinfection, and secondary fibrous cavernous tuberculosis. Breast carcinoma, you saw it last week, not difficult, large tumor with invasive growth, malignant, and focus of secondary necrosis in the middle. That's why cavity. Not present. Goose liver, easy micropreparate, fatty dystrophy of the liver. Liver is enlarged in size, flabby consistency, yellow color due to accumulation of lipids. That's why we called it goose liver. I can ask special staining for lipids. I think you know Sudan 3. Another. Nephrosclerosis. So you see two kidneys diminished in size, grainy surface because of hyalinosis and sclerosis of glomeruli and tiny vessel. That's why tiny scars. Maybe primary or secondary contracted kidney. If it is primary contracted, it needs vascular diseases like hypertension. If it is secondary contracted kidney, it may be due to glomerulonephritis. Nephrosclerosis. Let's go there. Cysticercosis of brain. I think it will absent to multiple cysts. That is parasite infection. This one is important. That is longitudinal section through heart. That is left ventricle, blood in cavity of pericardium, tamponade. What happens? First of all, thrombosis of coronary artery. You see brown thrombus inside of coronary artery. That's why myocardial infarction. It should be transmural infarction. That means infarction in all layers of heart. After that, rupture of left ventricle and internal bleeding. Blood comes through this hole to the cavity of pericardium. And this blood compress heart. That's why it is sudden death, and we call it tamponade. You should remember about transmural infarction and rupture. That one. Osteosarcoma, you see tumor. That is malignant tumor of bone, of tibia. Sarcoma, malignant tumor of mesenchymal origin. It has invasive cells and usually hematogenous. This one again last week, multiple layer myomas or fibromyomas of the uterus. That is cavity of uterus. It is compressed by multiple tumors. Multicentric growth, many focuses, benign because they are encapsulated, and origin is smooth muscles. Benign tumors of smooth muscles, multiple layer myomas. This heart, lungs, pulmonary artery, and that is thromboembolism. That is thromboembolus. How can we distinguish? Origin of this thrombus usually in veins of extremities due to varicose veins disease. After that, this thrombus come to the pulmonary artery and press to baroreceptors in this area. That leads to sudden death of patients because of pulmonary coronary reflex. That means contraction of spasm of coronaries and spasm of bronchioli together. So no breathing, no blood circulation, sudden death. Thromboembolism. You should remember that origin of thrombus is in veins, not in this place. That's why thromboembolism. Так. Trachea, bronchi, that is lung, and you can see large whitish tissue, that is lung carcinoma, hilar or central type because it arises from large bronchus. Peripheral type usually in periphery of lung, that is central type, and everything. This is tumor. What else can you see? Bifurcational lymph node and same white tissue, that is lymphogenic metastasis. From this tumor to regional lymph nodes, lymphogenic metastasis. Then you can see secondary focuses of this tumor in periphery of lung, and then very thick pleura, that is pleuritis, like reaction to the growth of tumor. Lung carcinoma, hilar or central type. This one, I think it's also absent, it is from today's class, that is rupture of spinal cord during delivery trauma, due to traction of the baby. This important micropreparate, nutmeg liver. It happens due to chronic venous congestion, accumulation of venous blood, excess of venous blood in the liver. That's why near central veins we see hemorrhages and fatty dystrophy, or sometimes hypertrophy of hepatocytes in periphery of lobules. That's why changes of different colors: red hemorrhages in near central vein and the dystrophy in periphery. Red, yellow resembles cut surface of nutmeg. That's why we called it nutmeg liver. Cause of it is chronic venous congestion, different cardiovascular diseases. Okay. This one again, today's topic, hematoma, subperiosteal hemorrhage due to ruptures of veins due to delivery, complications during delivery, hematoma. Interesting. This one, you see stomach, it is opened. Behind is pancreas. Again, you should rotate to normal position. It is not esophagus, that is pancreas. In the middle, you see large chronic ulceration, peptic ulcer, and it is complication of peptic ulcer, penetration to pancreas. Penetration. This one again, stomach. You can see part of stomach. Large tumor in the middle, that is carcinoma of the stomach. In the middle you can see secondary focus of necrosis, so that is ulcerative carcinoma because of ulceration in the middle. Histologically, that is adenocarcinoma because it is glandular epithelium. Again, spreading to regional lymph nodes, first of all, after that maybe hematogenous, spreading to other organs. And you should remember about some specific lymph node, metastasis, virtue of lymph node to the subclavicular, virtue of metastasis to subclavicular lymph nodes, Krukenberg to the ovaries, and Schnitzler to the pararectal tissue. Specific, read about it. And then let's start with it. You see, lung. That is lobar crupus pneumonia, consolidation of all lobe. It is stage of gray hepatization because of accumulation of fibrin and neutrophils. So it is stage of gray hepatization. Lung tissue is airless because of fibrin and resembles consistency of liver appearance. But lobar pneumonia with complication, you see cavities, lung abscesses. Pus is absent because of fixation, only cavities you can see. This one again, lung, 3 lobes, so that is right lung. And again, you see focuses of pneumonia, but small focuses. So that is bronchopneumonia or focal pneumonia. And same complication, abscess formation. Cavity with pus. Abscess pus is present in this case. This dark black colored lymph nodes, that is anthracosis, coal dust, due to smoking or air pollution. So here consolidation of all lobes, lobar pneumonia in this area, focal consolidation, bronchopneumonia, patchy consolidation. That one previous class. Carcinoma of the uterus, adenocarcinoma, malignant tumor of endometrium. This one, chorion carcinoma, chorion epithelioma, everything this is tumor, malignant tumor of chorionic villi. You should remember specific structure of this tumor. No stroma, no blood vessels, two types of tumor cells, cytotrophoblast and schizotrophoblasts, and that is carcinoma, but exception, hematogenous spreading because of direct contact between tumor cells and blood. No stroma, no blood vessels, hematogenous spreading. Chorion carcinoma, and it can produce HCG, human chorionic gonadotropin. This one, hydatidiform mole, benign tumor of chorionic villi. So you can see multiple swollen edematous avascular chorionic villi. Tumor is benign, and again, like this one, can produce HCG. This one, previous class again, ectopic tubal pregnancy, fallopian tube, fetus inside, hemorrhages in the wall, and then most common complication is rupture fallopian tube and internal bleeding. This one may be absent, I don't remember again. That is melanoma of the eye, easy. You see black area, melanoma, malignant tumor of melanocytes. This one, a small intestine, that is typhoid fever. You can see pairs patches, stage of medullary swelling. First stage of typhoid fever because of resemblance with brain. Pairs patches, stage of medullary swelling. First stage of typhoid fever because of resemblance with brain surface. It is called medullary swelling. Typhoid fever, first stage, medullary swelling. This one, part of liver. You see multiple nodules, overgrowth of fibrous tissue. So that is liver cirrhosis. Even subcapsule, you can see this nodule. Liver cirrhosis. Morphologically, that is micronodular liver cirrhosis. You can see small nodules, and usually micronodular monolobular. It arises from one lobule. That's why small size of nodules. Usually that is portal liver cirrhosis. Portal cirrhosis. Easy one, that is larynx, and you can see overgrowth of tissue inside of it. That is lung carcinoma. Oh, larynx carcinoma. What kind of epithelium is in larynx? Squamous epithelium. So histologically, it will be squamous cell carcinoma, maybe with keratinization or without, but squamous cell carcinoma of the larynx. This one, brain, and you can see accumulation of pus under meninges, so that is purulent meningitis. Easy one, maybe type of meningococcal infection. Purulent meningitis, or maybe septicopyemia and sepsis. This one again, brain, and here you can see multiple abscesses, cavities with pus, and again it may be due to sepsis, septicopyemia. You remember, pyemia means accumulation of pus. Septicopyemia. Так, больше ничего нет. И что у нас осталось? Что у нас осталось? Just next topic, maybe I will not show you. Anencephaly, absence of brain, and undeveloped skull. In this area, so brain is absolutely absent. And rachischisis, that means undeveloped vertebrae and soft tissues underneath. This is next. I think I will not ask. And this one is last, foot gangrene. Foot gangrene, that is dry gangrene. You see black areas with necrotic tissue. How can we distinguish dry and wet gangrene? We see clear demarcation line, like border between necrotic tissue and normal tissue. If it is visible, that is dry gangrene. Most often it happens due to atherosclerosis. Atherosclerosis of arteries, of lower extremities. That's all. Not so difficult, very different. But you should know a little bit theory, because I will ask you. All pictures and descriptions are. Yes. Forward.
Yes, I